Hello po, ako po si Jericho Arceo. Ito po ang aking third session sa Hollywood Spectra dito sa CSA Medical Aesthetics. Ang first two experience ko po ay first time ko syempre nakakaba, pero ayun, eventually okay siya. Meron siyang black charcoal na ilalagay and then yung laser gaganon na. So bearable po yung yung laser, di naman siya masakit. Sabi nga nila, tiis ganda. So third session na po ngayon. Thank you, CSA Medical Aesthetics. With that being said po, do not forget to click the like button and the subscribe button para po ma-update kayo sa kanilang post. And let's go!
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome back Mr. Jericho Arceo. There you go. So, in the past, we did a treatment for acne as well as the acne marks and acne scars. And we used the Hollywood laser Spectra. And then also, we did chin enhancement as well as jawline definition for Jericho. So here's Jericho right now. How are you so far?
Hi Doc, I feel great.
Yes, there you go. And actually, we also gave you medications for the acne problem. So he had taken this oral isotretinoin on a daily basis just to control any active or inflamed acne lesions, right? So checking on him right now, we notice a big improvement, correct? So
Correct,
especially on the lower third of the face, the jawline area, and the neck region. So he used to have this inflamed acne, mga pimples, right? And it's understandable because, you know, your age, you're still in your mid-20s, so you still experience these acne problems. Lifestyle, overwork, napupuyat,
Yes, Doc.
sleepless nights, right? So lifestyle, hormones, genetics, those are factors causing this acne problem.
This one.
So there are like acne conditions that we inherit, yun, genetics na yon. And then of course, yung iba acquired yung lifestyle mo. Tapos, ayan, diet na naman, the food intake, okay? So checking on Sir Jericho right now, I'm noticing his skin is a lot better. So we also did treat like enlarged pores and then those acne blemishes, and there's already a big improvement. Ilang percent kaya, Jericho, palagay mo yung improvement dun sa acne problem natin?
From before, Doc.
Yeah. Ilang porsyento? 50%.
50%.
Okay, considering we only did 2 sessions of the Hollywood laser Spectra. And the thing is, we recommend sessions of this one to really target those pigmented lesions, yung mga acne blemishes. We wanted a gradual improvement in a way because our skin color is at risk for those post-inflammatory hyperpigmentation. So we have the so-called Fitzpatrick color types. So we are in the 3, 4, 5 Asian skin. So we are at risk for having post-inflammatory hyperpigmentation. So when we're doing laser procedures for our skin color, we want it in a gentle way. So we don't want a very high energy whereby we have side effects of burning. Yan. Kasi at risk tayo. Kasi yung color ng skin natin, if we do like laser heat at mataas yung init, ang tendency baka mag-burn. So we don't want PIH. So for our cases of acne blemishes, melasma, post-inflammatory hyperpigmentation, or any pigmented lesions, even yung mga freckles, or yung mga from sun rays, yung mga pigmentations from sun rays, yung sunspots, or even age spots. Yan. When we treat these pigmentary conditions, we want to target the pigments in a gentle way. So, we do it in sessions po. So, we just did 2 sessions. So, 3rd session na po ni Sir Jericho ngayon. Now, I also have appreciated yung jawline definition. So, in the past, we used dermal filler, specifically the Juvederm Volux, to create that L-shaped angle of the mandible. So, chisel jaw, yung sinasabi na. And then, improve the chin area just in the right ratios and proportions lang po. And we want Jericho to still be Jericho. It's not altering his face, altering the anatomy of Jericho's face, right? Nakilala ka pa rin sa inyo when you went home.
Hindi na, Doc. Parang kala nila si Alden.
Okay.
Me. Still me.
It's still Jericho. Okay. So for our 3rd session of Hollywood Laser Spectra, we'll still be doing the carbon peel plus the multi-depth focus. It's gonna be a combined approach. So we'll show the procedure when CSA Medical Aesthetics return. And we're back. So we still have Jericho here and we have our Hollywood Spectra device here. So it's a laser machine using the Q switch and the YAG. Okay, so I'll again do the so-called carbon laser peel for Jericho. We've done this already in the past and we already applied the carbon lotion. We left it for about 10 minutes to up to 15 minutes. And this will be responsible for like attaching to the dead cell layer. And then when we do the laser, it will be sloughed off later on together with the dead cells. Okay, so for our treatment, okay, we'll start with the step 1 here, and the step 1 we're using the Spectra mode. So we need to cover our eyes, protect our eyes. We have a laser. Okay, so I'll start with the forehead region. Okay, so we'll apply 1 pass only. laser peel. And our next treatment will be the so-called MDF multi-depth focus, whereby we want to treat the enlarged pores as well as some of the sunken scars or acne scars, right? And actually, I really noticed a big improvement on Jericho's skin, because before there were noticeable enlarged pores on the mid-face section, on the cheek area, and then the acne blemishes were here on the jawline and upper neck. So before there were like elevated acne lesions, or what we call some cystic lesions, but now it's just flat, and we're just treating those acne blemishes. Okay, so very good improvement already. The skin is responding. So whenever we do also treatment, we recommend hydrating the skin moisturizing the skin so that there will be, of course, restoration of the water content of the skin. The skin will need around 50 to 60% hydration because most of the skin that we see here, they have this 30% hydration only. So it's ideal that you have a good moisturization of your skin to really improve the overall quality as well as also manage those acne blemishes and pigmentations. Okay, so I now have the MDF handpiece here. So it's different from the collimated handpiece, and our goal is to treat directly those enlarged pores. So the enlarged pores are still on the mid-face section. So we'll be using a low energy only, okay? So we're proceeding to the MDF treatment. So we want to target the enlarged pores as well as the acne scars. So we have the handpiece here, the multi-depth focus handpiece. It's different from the previous one, which is the collimated handpiece. So our target is, again, on the mid-face section, those enlarged pores that we see, okay? Just some, how's that? Okay lang po, variable. So we'll do like just 2 passes of this one. So it's a different approach. This is like a fractionated device here. So for colleagues who don't have the CO2 fractional, you can use this handpiece to treat those large pores as well as those acne scars. So we'll proceed now with the atrophic scars. Okay, so we have a different mode for atrophic scars. So our treatment here, we follow certain protocol for every skin condition. Okay, it's different for pigmentations, it's different for acne problems, as well as those acne marks or acne scars. So with acne scars, we have different types of acne scars: backscar scars, ice pick scars, rolling scars, undulating scars, or the opposite of those atrophic scars, the others have hypertrophic scars. Pag hypertrophic naman, the scar is elevated. And keloid is also a different kind of a scar condition. So we have a different treatment for those. So I'm proceeding with the so-called acne scar management. So with this one, I'm just going to be targeting those solitary acne scar lesions. Okay, this one. Okay, the endpoint for this one is a so-called petechiae. So a while ago, the enlarged pores, the only endpoint is erythema or redness. Okay, so I'm just checking on the atrophic scars that I see. So few lesions only, Jericho. So you heard the 3 kind of sounds like firecrackers, something like that. Okay, and then let's proceed to the opposite side. Okay, so let's just look on the acne scars here that we see here. Okay, we're still good. Parang wala na masyadong makita. Nawala na. Just targeting. Okay, just a little bit more. Okay. So after this, we'll be applying a soothing cream we call hydrocortisone, just to reduce any redness or petechiae lesions there. So we've done the combination collimated treatment using our Hollywood Spectra laser, the carbon laser peel. We also apply the so-called multi-depth focus, the fractionated part of this Hollywood Spectra. Now, I've also noticed that Jericho has this facial hair. Okay, so on the lower third of the face and the upper neck area, and he asked me a while ago, like, does this laser remove those hair follicles? We have a specific device that can do a so-called hair removal, and that device is the diode laser. So it can target hair follicles, hair roots, to eradicate those unwanted hair. So I'll ask Jericho, are these unwanted?
Yes, Doc.
There you go. And actually, I would really recommend it to Jericho because he's prone to acne lesions in these areas of the upper neck. Plus, he's prone to the so-called folliculitis also, because in the past, I noticed that there was this folliculitis. So for those kinds of conditions, if it's like on and off, you treat it and then it's gonna come back again, then treat it and come back again, something like that. So you can make use of a device called diode laser hair removal. Actually, also the ND-YAG also has an effect, although we specifically recommend diode laser hair removal to get rid of this unwanted facial hair. So we have an added procedure for Jericho, which is the so-called diode laser hair removal. We'll continue for more treatments when CSA Medical Aesthetics return. So we'll now show the result to Jericho. Jericho, here's the mirror, and you can already check on your skin, on your face, right? So we did the so-called Hollywood laser peel, the third session of that one, plus the multi-depth focus. It's like the fractionated laser for acne marks, blemishes, scars, as well as enlarged pores. And we also did the diode laser hair removal to eradicate, okay, the unwanted hair around this area, so jawline and upper neck, to also prevent acne recurrence as well as folliculitis, because acne is a condition of the so-called pilosebaceous unit, okay? So with our treatment right now, we've targeted the hair follicles as well as the sebaceous glands, because the Hollywood laser peel, the Spectra laser, also target the oil glands. The sebaceous glands are being contracted inside. So we're managing all those conditions, and at the same time, we're also doing the so-called dermal collagen stimulation to tighten the skin, firm the skin, as well as target the enlarged pores, make the pores tightly closed. Okay, so Jericho, how was the experience?
Very less fearful, because I know what to expect.
Exactly.
But also the problems I have with my face, and the problems I didn't know I have.
Correct. Yeah, you just found out.
Oh, I
you
have that.
realized all those skin conditions. Okay.
Yes po.
And considering also Jericho has a family history of like skin allergies, right?
Yes po.
So like dermatitis. So we're also we want to be very careful also with whatever we're doing for him. We don't want to trigger any allergic reaction. And there's this condition we call periorificial dermatitis. It's a common condition, like sensitivities around the mouth area, okay? Another thing is with the diode laser hair removal, actually what it is really targeting is the melanin pigment around the hair follicle. Okay, so it will also lighten the skin. So apart from eradicating the hair follicles, we are also depigmenting the skin in a way that those unwanted pigmented lesions on the upper neck, you are also treating that. So you want to have that homogeneous skin color, right? So even skin tone, there you go. So those who have concerns regarding enlarged pores, recurrent acne, or acne that are resistant to, standard medications, or those medicines that you buy from drugstores or over-the-counter topical or creams, or conditions that have like even folliculitis, okay, and then those who have comedones, blackheads, whiteheads, and even those pigmented lesions. So we have these kinds of devices, machines, lasers, that can target those skin concerns, okay? So we have a lot of people inquiring about like, Doc, what do you do with this? For example, what do you do with this kind of acne scar or this kind of facial scar? Or Doc, do you have a treatment for this acne blemish? Doc, I have a sensitive skin but I cannot apply like those tretinoin, retinoic. My skin reacts to those. So really recommend that you go to a specialist, those who are trained to manage also acne conditions, especially with those with severe acne vulgaris, because we really have to give them the right treatment, because there are also like complications when you give an incorrect management, right? Because some people have sensitive skin. Some people are using even chemical peel for acne. There are like chemical peels for acne lesions also. Like you've heard of salicylic peel, glycolic peel, Gessner peel. So these are made of acids. So very strong acids, but some people do not respond to them. They just react in a way that it causes burning, okay? Or a pigmentation, okay? So we don't want those kinds of complications. And we just want the right treatment, the safe treatment. So we have combinations of procedures for a best outcome, optimal result lang, okay? And safety is there, ano pa? It's effective, it's scientifically studied, of course, evidence-based science pa rin tayo, because right now I've been hearing like centers opening, even like beauty salons, okay, they can do treatments, but somehow we still recommend that you go to like doctors who can really manage these kinds of skin conditions, because whenever there's a complication, they come to us and it's more difficult to treat complications already po. So, and then the thing is, we spend more money, right? So, mas lumalaki po yung gastos. So, thank you, Jericho, for joining us again. And also for trusting us. Of course, we really value your, you visit our center. There are other centers that you can go to. And we want to take good care of the, how we manage you. We want to give the best. And of course, for the glory of the Lord, okay, give the best to our Creator. Thank you. If you have any questions, you may email us at csaskinclinic@yahoo.com, FB page CSA Medical Aesthetics, our Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917504468. Jericho, meron ka bang social media that they can follow you?
Yes, Doc.
Yes.
Please, guys, you can follow me sa Jericho Arceo. My name.
Yeah, also I'm following him and I'm listening to his short talks, some very powerful messages there, and you can apply it in your daily life. Yan, mga basic, mga practical messages para po sa ating lahat. So thank you, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.